Tansei, broadcasting live from unceded and unsurrendered Algonquin territory. My name is Marion Crow. I'm a certified First Nation health manager. I'm living in Ottawa, but I'm from the Pie Pot First Nation in Saskatchewan. It's a pleasure to lead the First Nations Health Managers Association. We have a great panel, as always, on the First Nations Health Managers Association virtual town hall. Before we get into our guests, a couple of housekeeping items. For anyone who has questions for any of our panelists today, don't forget to email them to fnhma@ihtoday.ca. Thanks, Indigenous Health Today, for making sure that we're able to put this out. I know we hit anywhere from 5 to 15 to 20,000 live viewers, plus all of the repeats afterwards. You can check us out every Thursday, same time, same bat channel, going until Thursday, June the 25th. So we've extended these and are excited to keep bringing information to you. And thank you for welcoming us into your nations, into your homes, wherever you are being safe. We thank you, and thank you to everyone who's working to keep COVID-19 out of our communities. We hope that you find this information useful, and don't forget, send your questions to fnhma@ihtoday.ca. If you are wanting to listen in français, we have Pascal Belanger, who is doing the translation for us always, every week. So please join Pascal in French. And we also want to say thank you to APTN, who is broadcasting live on their Facebook news page as well, the FNHMA Facebook page as well. And we'll get into all of those thank yous at the end of the show. Speaking of the show, are you guys ready? It's really hard to be excited, by the way, about such a heavy topic. So I hope you don't find my friendly demeanor taboo. It's just we need to smile and get through this. We're united First Nations Health together. So without further ado, let me tell you our lineup. We have the Canadian Aboriginal Council on Midwives with us. We have Thunderbird Partnership Foundation, and of course, First Peoples Wellness Circle as well. So let's get started with the dialogue. First up, we're going to welcome Carol and Claire, who are from the National Aboriginal Council on Midwives, sorry guys, and welcome to the FNHMA Town Hall, and thank you for exhibiting every year with us, at least last year for sure when we were at the conference. We really appreciate your participation, and people want to know what's happening. So we'll go right over to Carol.
Good afternoon, Nanin. I'm Carol Cucci, Nando Gijikwe Indigenous, Nabising and Dunjaba. So I'm here in Nabising territory. Our community is located between North Bay and Sturgeon Falls in Ontario. I've been a midwife for 20 years, a registered midwife. I was one of the first people that got through midwifery in back when it was first legislated in Canada. However, Indigenous midwives have been here in all our territories since for time immemorial. The saying goes, as long as there were two women together and one was having a baby, that was the birth of midwifery. So we were really well versed in traditional medicines. We were healers, cultural bearers, carriers of ceremony. We stood at the doorway of life and death. And our profession encompasses many things, work that nurses, physicians, social workers, spiritual people. This is the scope of and the breadth of our knowledge. So you can imagine when the collision hit 500 years ago. At first, we were recognized and honored for our knowledge as the new people came here the new settlers came here and searched us out and needed to know plant medicines and obstetrics to help the women that eventually came. But after a time, physicians and nurses aligned themselves with hospitals, and birth became something that happened in the hospital through the colonial medical system. So this was something that affected our midwives in a very negative way. And as we all know, our women have suffered greatly as a result of that. So now we have a medical system, particularly in the north and rural and remote areas, that is not unable to cope with that's
Hi there. I'm going to interrupt for just a moment, Carol. It is appearing that we're having a bit of a bad internet connection with Carol. We're going to pause there for a moment, and sorry to interrupt this great discussion. Carol, if you can hear me, maybe you just want to pick up the phone and dial in, and we'll pop up your beautiful headshot that you've sent in. And while you do that, we'll go over to Claire, and we'll try Carol again while we resolve. And believe it or not, we do these checks an hour before, so we'll get that resolved so that we don't miss this important message. And Claire, if you can hear me, I'm going to ask you to step in while we reconnect to Carol. So over to Claire.
Sure, of course. Sure, of course. And again, thanks for having us, and good afternoon, everyone. I'm Claire. I am a Indigenous registered midwife. I'm Lenape, Potawatomi, and mixed settler, and I work here in Toronto at an urban Indigenous midwifery practice that takes care of a wide range of Indigenous and non-Indigenous people living in Toronto. So I'm gonna hopefully let Carol finish what she was saying, and I'm going to talk a little bit about what it is that we're doing as Indigenous midwives to support access to clinically excellent and culturally rooted sexual and reproductive health care during COVID-19. So as Indigenous midwives, we approach our care through a reproductive justice lens. And we do this all the time, but I think what is the importance of this is really being highlighted during the pandemic. Many of us have been working to try to set up contingency plans that include asking hard questions and looking at difficult things that our clients are going through and talking about and trying to figure out how we provide the best care possible without, while also limiting the spread of the virus, and working in situations where often our resources are already stretched thin. So as Indigenous midwives, we need to look after our pregnant clients and their newborns and their families, but we also are taking into consideration trying to care for and protect our elders and our wider community members. So our care often extends beyond the clinic. And beyond pregnancy and birth, really. We care for those who are already living with illness, who already live with compromised immunity. We care for people who are living in overcrowded homes, living with mental illness, substance use, and trauma. And COVID-19 is really adding an additional layer to our work. And what we really feel that we need to do as Indigenous midwives is examine and address how the pandemic is affecting the sexual and reproductive health of people who are already experiencing increased health burdens and who often have a lack of access to safe and culturally safe reproductive care. So as midwives, we're really trying to address the advice given to pregnant people around COVID and how that relates to our Indigenous populations, and make it applicable to our communities. So, we're trying to ask ourselves questions like, how do you self-isolate before your birth if you live in an overcrowded home or you still have to go to work? How do you decide between having a support person in labor and between keeping your family safe when you may be returning home to an isolated community where there is no COVID and where there is less healthcare infrastructure? Or things like, how do you access your birth control when you normally access it from a walk-in clinic that is now overburdened with people who are sick, or you don't want to go and expose yourself to people who are sick, but you still need to be accessing your sexual and reproductive health care? So these are things that we're really trying to address during the pandemic as Indigenous midwives by continuing to provide the usual care that we provide to our families in the community, and as well as in hospitals, but also working to try to figure out how we can partner with other healthcare providers and other organizations to really expand our scope and what we're able to do to meet the needs of our clients. And by going out into our communities when other people won't, or by reaching out to those people who are continuing to need to have care. People are still having babies, people are still pregnant, they still need access to sexual and reproductive health. So one of the things we're really trying to do is think about how we as Indigenous midwives are already set up well to provide care in the community. It's what we do. We provide care in the community, in people's homes, outside of our clinics, outside of the hospital. And so we're really well situated to be providing that care to people, while also thinking about the unique needs of our communities. So I think one of the things particularly that we're really doing is have the ability to give, to provide birth services outside of hospitals. So this is something we already do. We know how to be safe outside of the hospital. We know how to screen people, like do risk assessments, and to screen people who are good candidates for out of hospital care. And this is one way that we're really trying to ensure that people have access to good health care.
Thank you so much, Claire, for those words. And, if we're listening to all of the social media chatter that's happening about all the births we're going to expect in the next 7 months, you're definitely going to be called upon even more, Claire. So I'm just going to see if we had an opportunity to get Carol back to talk a little bit more about the council and the important work that is happening at the council. Uh, Carol, are you with us now? I'm just waiting for something. We're not sure if she called in, so we're just tracking her down, and I'm so sorry. That's just another thought. The internet connectivity is definitely challenging at best. And Carol, I think you might be on now, so if you wouldn't mind pressing *6 and unmuting yourself, that would be spectacular. Carol again? So back to my rant about access to services with respect to internet and connectivity. I know a number of organizations are talking about the importance, especially youth, having access, and having COVID-19 really just puts a spectacular light on the need for access to connectivity and internet that is adequate. I'll just share a couple of thoughts with you around what's happening at FNHMA. I know that some of you are already using our newest service. So the newest service is InfoPoint. And if I were to say, do you guys know what it is? Show me in the audience. I know the hands would be up because people are using it. So in response to having a place where you can find COVID-19 information that's credible and relevant. FNHMA responded with InfoPoint. If you look at the logo of InfoPoint, you'll actually see there's a compass in it so that we can support in navigating you to the right resources at the right time. If you want to get in touch with the team at InfoPoint, you can do so from Monday to Friday from 8 a.m. to 8 p.m. Eastern Daylight Time, and you can do that in the language of your choice. I'll be clear, English and French. We don't have enough translators to speak all of the beautiful Indigenous languages that we have, but we will service you in English and French. And the number to call us, if you want to call in, that number is 1-855 446 2719. And look for our partners at APTN for a public service announcement with commercials on InfoPoint. The email address, should you wish to send an email, is infopoint@fnhma.ca. So we're excited to get your questions and respond to you in a rapid way. We're committed to 30 minutes in responding to your questions that you may have. All right. So I know we're getting a couple of notes with respect to Carol still trying to join us, and that's the midwives, Carol. So I think what we will do right now is I think we're going to transition over to we're going to transition. Oh, and she is on the line and can hear us. So, Carol, if you can hear me, if you just want to press *6 on your phone, and that'll unmute yourself. No such luck yet. All right. Well, this just gives me time to say a quick hello to some Facebook watchers. Mel Demers, I know you're watching, and you started your career at FNHMA as a summer student. Hi, Mel. And Seymour, welcome to your role at Indigenous Services Canada as a PhD student and a certified First Nation health manager. Darlene, our faithful Atlantic board member, we see you too, and I hope to. No, that's a different show. I hope to see you again on. No. All right, enough clowning around from me. Let's get back into the serious discussion of COVID while we wait for Carol. Let's get Carol Hopkins. Carol and Brenda are going to chat about how we are looking after our health leaders. And you're all health leaders listening in on the radio, tuning in live, and it's a marathon. We get that. You must be so exhausted. And how are we caring for ourselves? So, Executive Director, Thunderbird Partnership Foundation, Carol Hopkins. Welcome back to the FNHMA Town Hall.
Good afternoon, and thank you for the invitation again. We want to bojo no jam Indigenous cause gaye maingan and dodem lane lanape and dow mede wana kwe and dow lanape a king and donjabas. So I am Carol Hopkins, and I am calling in and joining you today from the Delaware Nation at Moravian Town in southwestern Ontario, which is where my mother's family line comes from, and where the Thunderbird Partnership Foundation head office is also located. My father's family comes from the Munsee Delaware First Nation, which is just further up the Thames River. Thanks again, Marion, for the invitation to present today and join the discussion in this town hall. I am amazed at your patience and your steadfastness. I would be a nervous wreck if things didn't go according to plan, but you handle that like a pro. So that says a lot about how you're taking care of your own mental wellness as a leader. When we think about mental wellness and leadership together, I think, first of all, that there are leaders by position. The election of our chief and councils, the appointment of executive directors, there are those kinds of leaders. But more importantly, and or maybe just as important, are leadership characteristics. And those are amongst all of us. And so everyone has an opportunity to be a leader in their own life. And so when we're thinking about our wellness, I want to talk about wellness from an Indigenous perspective. And this comes from the work that we led in conversation across different cultures in Canada. We know our cultures are diverse, and they are defined by our languages and by the land that we live on. But as we had a conversation about what is wellness and how do we do that, what helps us to sustain our wellness, we found common threads across the diversity, across the differences in our culture, and it resulted in the Indigenous Wellness Framework. And so that's still relevant today when we think about how we take care of our wellness in the context of COVID-19. Boy, we have a tough job every day, whether we have a pandemic happening or not. We have the challenges of inequity and the intergenerational trauma that still exist. And on top of that, we're having to navigate the landscape of COVID-19. And as leaders, depended on quite a bit to have the answers. And so, like many others, we rely on Indigenous knowledge. And so that tells us that that in order to facilitate wellness and take care of ourselves, that we have to have some organization to that, some anchors to draw on, something to guide us as we move along. When we get really frustrated or we get full of anxiety or we feel all the pressure to have those answers that people are looking for, then we have to be able to navigate that and secure ourselves with something we can count on. And so that's what the Indigenous Wellness Framework does. And first of all, it talks about hope. And that's about our spiritual wellness. And our spiritual wellness comes from our identity. And so in this time, in this age of people on the earth, we have our identity still intact as Indigenous people. I introduce myself by my name, my spirit name, by my clan, by the nation I come from, and the spiritual society where I draw my knowledge from. And so that's our identity, and we still have that intact today. Maybe you don't know what your spirit name is or what your clan is, but knowing that you are Indigenous can be a strong source for giving you hope for the future. And by that, what I mean is, just like the midwives are talking about, they're involved in the lifespan. Helping life to come into this world is such a blessing. And as we come into this world, we come into this world with the identity the Creator gave to us. So it's a sacred identity. It's given by the Creator. And maybe we don't know very much about it, or maybe we know a lot about it. But despite colonization, intergenerational trauma, racism, oppression, all of those experiences that we have had, none of those have and can remove our identity because it is given by the Creator. We always have it. So it's never too late to learn. So when we're thinking about, how do I navigate this environment that we're in, and where do I draw my strength from, and how can I bolster myself, my spiritual core, then have discussions with others about your identity. How did your ancestors handle the pandemics they were involved in? And how should I think or feel about what I need to do? What is my purpose? And so that's another one of the elements of the Mental Wellness Continuum Framework that is strongly connected to hope. It's understanding that embedded in your identity is your reason for being and your purpose in life. We all have purpose. And I'm so happy to be joining this conversation today with midwives who are talking about birth, because I think about all of the children that are being born, all the babies that are being born in and amongst our communities, First Nations communities, Indigenous communities. that they are going to have a special story to tell. They're going to have a special story around their birth and about the time that they were born in. Elders that I have the good fortune to have conversation with, they talk about this time as the correction time. There's lots of things that are being corrected, and because life always has to have balance. That's natural law. That's spiritual law, and human beings, we can get in the way of that, but creation and the forces of nature are always going to be working towards harmony and balance. And so the correction is, how can we be part of that? And it starts with how we take care of ourselves. I heard other speakers over different meetings talking about it's really important that you take care of your diabetes, or it's really important that you take care of whatever that chronic health issue is that you might be facing in yourself or in your family. And really what they're talking about is maintain balance. Find ways to ensure that you are bolstering your immune system. And so from an Indigenous perspective, one of the ways that we can do that is by honoring the relationship that we have with all of creation. And so different communities are holding their ceremonies. And from the outside, maybe there's not a lot of understanding about the importance and significance of those ceremonies. But those ceremonies are all about prayer. They're about connecting with the Great Spirit. And so they are ways of taking care of wellness. And they're not just praying for themselves or just their own community. That belief extends everywhere to all people. And so if you're not a person that knows how to pray or knows about ceremonies, take comfort in the thought that somebody else is doing that. And that message is going the message to the Great Spirit is inclusive of you. So there are other people that are thinking about you. And that's what our ancestors did for us when they were going through the pandemic. They thought about how are all of the ways that we can take care of life today to ensure our future. That's another responsibility of leadership, is to ensure the future. And so the question that I think we ask ourselves as leaders of our own life, or if we are in a position of leadership, is what is my purpose? Because you too are in that role, not by accident. You must be a leader in this time because you have the ability to offer that hope to others for their future. You must have the ability to make sense and meaning out of what your community needs are. And if you don't understand everything, because no leader does, no leader has all of the answers, you have to give yourself a break there, then you also know that there are people you can reach out to. You can reach out to for answers. And all along the life path, there are those teachers for us. There are the elders and the Indigenous knowledge keepers. But there are also young people and young adults who carry that knowledge and have a different perspective. We have to pay attention to them. And then even the voices of children, they watch and they observe, and they have an important perspective to share with us as well. And so their voices and how they see the world are incredibly important. My grandson said to me the other day, "Grandma, aren't you supposed to be exercising? Grandma, you need to take care of yourself and you need to exercise. You need to ride your bike." Such an important reminder for me. And so I share with you the ideas of hope, belonging, meaning, and purpose, and encourage you to look up the Indigenous Wellness Framework on our website and learn more about that to guide you in terms of how you take care of your own mental wellness. Thank you very much.
Carol, you always put water in my eyes. So thank you for that. I'm always grateful for when you speak about hope, purpose, belonging, and such an important message, and how we are leaders and need to be well. A little moment here. I apologize. So, while I get my waterworks contained, I would like to call now, just a note, we're still working on Carol to join us as well. So thanks, Carol Hopkins. We'll await word from the studio on Carol, and we'll move over to Brenda. Dr. Brenda Restool, the CEO for the First Peoples Wellness Circle. Keep bringing water to my eyes, happy and hopeful ones. Welcome back, Brenda.
Thanks, Marion. I'm really glad to be back joining this town hall this week. Such important topics, and thank you to all of those ahead of me who've shared some really important messages around taking care of ourselves and taking care of those little ones coming into the world and those very precious people who are bringing in new life. So those are really, really important. I just would like to acknowledge I'm sitting in Nipissing First Nation on this beautiful day looking out over the water, and thinking about self-care means that we need to be thoughtful about what does the land teach us. And in that conversation, I'd just like to start, I think, by recognizing that so many leaders listening to today's town hall, as health directors, as our political leaders and chief and council, our leaders in the community, in our homes, those natural helpers, our elders, all people are working really, really hard to ensure the wellness of our community. And I think each of us, no matter what type of leader we are holding a really significant weight on our shoulders right now, trying to make good decisions and make sure that we're getting out good information, that we're making good choices to ensure our physical wellness. But we also need to be thinking about our mental wellness as well. And I think, all of us, and I think about our political leaders, how much they have had to weigh the pros and cons about making the decisions in our community about when to close our band offices and our health centers, and when we should reopen and how we should reopen. Those are really critically important questions about how we take care of our wellness socially, economically, mentally, physically, spiritually, and emotionally. And when we have that, it can really weigh us down. And we're busy trying to make sure everybody else is well. But if we don't start with our own wellness, we could perhaps make decisions that aren't good for us and for those around us that we have that we're taking care of. And so I think, leaders' decisions are are often really analyzed, both from within our community and external to our community. But one of the things that can help us around our decisions is thinking about placing mental wellness as a central piece of that, because when we think about our mental wellness, that helps us to make decisions about when and how we take care of everybody. And so we need to first start by being a champion in ensuring that we talk about psychological distress and how to address that for our nations and for ourselves. And sometimes being the role model helps us think about psychological distress and how to manage that. And so thank you to my friend Carol Hopkins for talking about hope, belonging, meaning, and purpose. Many of my topics are similar to that, but I'll try and use different language. I think here are some ideas that I would tell our leaders about managing mental wellness. Maybe I'm going to sound a little bit like a mom right now, but first things first, we need to have good routines. We need to be thinking about our sleep and our work schedule routines and our sleep and wake schedule. So making sure that we are going to bed at a good time, we're getting a full amount of sleep, and we're getting up at a good time of the day, not getting up, in the middle of the afternoon and staying awake all night. Having a good sleep routine is something that helps our brain to be active when it's supposed to be and rest when it's supposed to be. And we need all of our brain functioning because we are on these virtual platforms all day long. And so we need to be really mentally sharp. And so having good sleep and wake schedules is important. Making sure that we have really good regular meal times, making sure we're eating when we're supposed to and getting in the nourishment. Our bodies and our brains need to have that nourishment to be able to be focused and concentrated and make good decisions. So we need to have those pieces of taking care of ourselves. We also need to be scheduling our day to make sure that we have breaks. Each and every one of you can probably say some days you forgot to not only eat, but you forgot to get up and use the bathroom. You forgot to get up and stretch. So make sure that you're taking the time to get up and take a break, to move around your house, to move to a different portion of your house, to stretch, and to make sure your muscles know that you're still moving. When we are moving our muscles, we're helping those chemicals in our body that can help keep us active and engaged and energized, all the things we need for being prepared to manage our day. Of course, one of the things I've told my children, get up, get dressed, brush your teeth. Doing those kinds of regular things that you would do when you weren't in a pandemic is important. Don't sit in your PJs all day, even though it's really nice to do so, and you don't jump in the shower. When we get up and we do those normal days, we are cueing our brain that we are starting our day and that we are going to move into our routine. When we don't do that, our brain is like, this is a day where we can just do whatever, and we might not be as sharp and focused as we want to be. So that's a little bit about making sure we tell our brains and our bodies we have purpose by getting good sleep, good wake routines, eating, and by making sure we get dressed and follow those kinds of routines. The next thing I'm going to say is plan your workday. I already talked about breaks. Make sure you plan into your workday breaks. Make sure you consider how much time you're spending on different meetings. So if you've scheduled Zoom meetings or teleconferences from 8 o'clock in the morning till 8 o'clock at night, that's not okay. We don't want to be able to do that. Exactly. We want to make sure that we are taking time to shift to different types of activities. We want to spend a little bit of time on virtual platforms, maybe a little bit time on the phone, a little bit time looking at our computer, and maybe also taking time away and engaging with the people in our homes if we can do that, and then coming back a little bit later to our work activities. Make sure that when you're planning your day that it's okay to also say no to some things. Don't feel obligated to get on every call and be part of every conversation. It's not necessary. Make sure that you limit your time in front of a screen for emails or Zoom meetings. Did you know that there's such a thing as Zoom fatigue? Zoom fatigue actually means that our brain has been spending so much time being on Zoom that it requires us to be more focused and more attended to what's happening. So when we look at that screen and we see those 15 faces, it's like the Brady Bunch. We're trying to look and make sure that we know and we see all of those faces, and we're trying to read 10 or 15 little faces. Our brain is working super hard to read nonverbal cues that are really hard to read during a Zoom meeting. So our brain is on overdrive when it comes to Zoom meetings. We want to be able to help it by taking a break and turning off your camera if you can. It's really weird to watch yourself in a Zoom meeting and see yourself. That's not what we usually see during a meeting. We don't watch ourselves. So turn your own camera off. That's one way of helping your brain. The second is maybe not spending as much time watching that chat screen on the side, turning it off and reviewing it later at a different time if absolutely necessary. Those are all really critical things. Our brain is working so hard at reading that, and we need to give it some help to reduce its extra brain power that it's taking. The third thing I'm going to say is make sure you schedule self-care into your day. So find ways to be disconnected. We're usually used to ending a meeting and thinking about going out for dinner, returning home to the family, going shopping. Those things are not part of our day anymore. So find other ways of being disconnected. Think about, who am I going to connect with instead? What can I connect with in my surroundings? Can I connect with the people in my home, my children, my partner, my family members who might live with me? Can I get on the call and talk to a mom or an auntie or a grandma and just have a fun chat, and something that doesn't require as much brain activity? Yes, maybe getting in front of a television, but again, thinking about not too much activity of the screen as a way of disconnecting. Think about also connecting to the land. So Carol mentioned connecting to the land, finding ways to connect to things that make us feel good. It's springtime. Get out there and notice those buds on the trees, those blooms coming up in your flower beds if you have those, to see that the water and the loons going across or the ducks swimming. Those are all good things to look at, disconnecting and reconnecting instead to those parts of our lives that give us meaning and hope, as Carol was talking about. And then I'm going to say, have good ways to manage stress, anxiety, and worry. So recognize you're not perfect. And this is a new experience for all of us. None of us know the answers. There's no right way to do things. We're all going to figure out things a little bit differently based on our skills, based on our communities and the resources that they have. So, give yourself a break. If you don't get it right, it doesn't mean that you are failing. Be okay with taking breaks. Be okay with not being perfect. Be okay with trying to ask for help when you need help. So be kind and gentle to yourself and to those around you who are also doing the best job that they can. Know your limits. Think about, when do you need to say no? When do you need to take a break? Do you really require to be on that teleconference or that Zoom meeting, or can somebody else do it for you or send you the notes later? Know how to find balance. So use your body as a way to tell you how you're coping. Are you stiff? Do you have a headache? Are you irritable and impatient? Those are all indicators that you're overstressed. And I would say in those cases, we should use some basic techniques. Are you breathing? Don't hold your breath. Don't take short, small breaths. Take nice, big, deep breaths. Sometimes I tell clients of mine, if you're not sure how to take deep breaths, think about when you're drumming and singing. For those who use drumming and singing, when you drum and sing, you have to have good rhythmic breathing. So if you're a drummer or a singer, use singing as a way to get good, deep breaths. Think about using mindfulness, so being in the present, enjoying what you're doing in the moment, enjoy that food you're eating, even enjoy putting your hands in the water and washing dishes, enjoy going out and smelling the air, enjoy doing things like prayer. Those are things that give you sense of mindfulness, being in the present and not worrying about what meeting you need to be at next or what decision you need to make next. And then use calming strategies. So if you're into meditation or progressive muscle relaxation, doing drumming, all of those things are helpful. Smudging will also help with mindfulness and with calming. And lastly, make sure you exercise. So get out there, go for a nice walk. The days are beautiful, the evenings, enjoy the sunset, enjoy the sunrises in the morning if you're a morning walker. So use all of those to find hope, belonging, meaning, and purpose in your life. Thanks, Marion. Miigwech.
Thank you so much, Brenda. I looked down and saw a little flashing down on my screen from one of my staff, and written in all caps is, "Are you listening to Brenda?" So thank you. I really appreciate that. The other message I'm seeing on my screen is that we do have Carol back from the National Aboriginal Council of Midwives. So Carol, let's take two and welcome back. If we do have more technical difficulties with the connectivity internet, then we're definitely going to invite you back, because we don't want to lose the birthing of this opportunity. So Carol, welcome back again.
So can you hear me okay now?
Absolutely. Thank you.
That's amazing. Thank you so much. Okay, so I was launched into a rant of what we all lost when we lost midwifery. I just want to thank the previous speakers, including Claire, but I'm really trying to listen to you, Brenda, because I think we're all suffering from not only COVID fatigue, but Zoom fatigue and the stress that comes with it. So I would say personally, as a midwife who's delivered many, many babies and has worked in this profession for close to 20 years in a variety of communities, both in urban areas and remote areas. So midwifery took a big hit when the medical system came and sort of took over our work. We gained a few things with the coming of modern medical science, with the cesarean section capacity, things like anesthesiology and those kinds of things were real breakthroughs in women's health and childbearing, but it removed from our women in our communities the balance that came with that sacred ceremony of birth and all the other things that surrounded it. And it became only about physical safety and removed the other three parts of the whole human being. So the spiritual, emotional, and the mental were all removed from us. Our women were told what to do. They were scared into doing things a certain way to please physicians and caregivers. They were removed from our communities down to urban centers where they found, they didn't have their own food, they didn't have their family, ceremonies were not appreciated. So there was all these things that caused the breakup of this sacred ceremony of birth and all that went with it. Now the ceremony still went on. Obviously, we're here. The babies are here. They continue to come. It's still a blessed and sacred event. However, the things that made important things that helped grow that little person in a strong and good way were I won't say devastated, but were diminished. So when a baby is born and it's put on the mother's chest and they're able to learn to breastfeed in that first hour of life, that is the seeds of good mental health. This is what makes a strong person. It's front-loading the system and making it strong right from the beginning, both for the mother as a brand new mother, when we're a first-timer, and the baby. So, and as that mother learns for the first time how to parent, it's that midwife that holds that space and makes those good seeds planted and grow. She's like a warrior watch person that protects that mother and protects that baby and helps that mother find her voice and come into her own power. And that's what was lost when our midwives were no longer at our side. So what do we see in our communities, in our statistics? We see things like child apprehension rates at record levels. We see breastfeeding failing. We see teenagers lost, including like when people in important transitions where people really are struggling. We hear about the missing and murdered Indigenous women. These are things that are happening to a community that has lost leadership, lost purpose. So all these things that we're bringing back into our communities that the previous speakers have discussed so eloquently, it was a midwife had her finger on the pulse of those communities around health that watched to make sure those terms were kept out, not just for them, but also that the men were in line with what they had to do. I'll tell you that in Anishinaabe, I've sundanced many years. I've been to ceremonies like Purification Lodge, Sweat Lodge, fast, all these things, I could talk to you about how they are birth simulators. They put our men through the process of what a woman goes through naturally. So when a young girl goes through her menses, woman has a baby, are the old ceremonies in our community. And it's not that they're gone, it's the leader of those ceremonies has been harmed or taken away. I can tell you today that the National Aboriginal Council of Midwives, we're on our way back. And we're really, really working hard to bring midwifery to every community so that every Indigenous community has midwifery again. And and I know that many of our nations and incidents asking us questions, wondering how they can get midwives in their community. They're inviting us in to help us get them started. And all I can say, it is a slow process. And I resent COVID for a whole lot of things, but the main thing is it's taking away my real work of getting midwives back. Because there has never been a more critical time where we can see how important midwifery is, especially when we have communities that are on lockdown, people can't go anywhere, they're afraid to go to the hospital. And here at Nabising, we're really, really fortunate at Kitagani Midwives. We have a little birth center. People don't have to go into the hospital. Where Claire works as well in Toronto, people don't necessarily have to go into the hospital. If they're healthy and well and their pregnancy's been fine and their labor's okay, we can deliver them in a place where they aren't bringing sick people. And we're talking about different recommendations for those kinds of things to be followed. So I'm not sure how I'm doing for time here, but Marion, I'm not sure if you have any other questions or if I've said enough.
Carol, I do have a question for you. If somebody is interested in bringing back, and as you call the resurgence, we really need to have these birthplaces back in our nations where we've always been. How do they get in touch with your organization to start that process? What does that look like?
Well, we have a website for the that we can get you guys to put up. But if you just Google the National Aboriginal Council of Midwives, it will come. I think it's aboriginal.midwives.ca, I think. I'm really horrible with that.
That's all right. Thanks. I just wanted to let our viewers and our listeners know that they can reach out to your organization and have that discussion, and definitely see more information on www.indigenousmidwifery.ca. So feel free to reach out. Carol, thank you so much for that. I think what I'm going to do now is that we have a minute or two to go over to the inbox. So I'll just ask that Carol be muted now, and I'll come back and ask to unmute her should we have a question directed that way. The inbox is quiet today, and I think people are just in awe of the information of hope, wellness, belonging, the welcoming of births in our nations by midwives who have been in community forever. But there is a question here, and I'm actually going to go over to Carol Hopkins for this comment and question, because Carol, while you don't put Dr. Hopkins in your signature, in our world, you are Dr. Carol Hopkins, and you know what I mean in terms of your knowledge and the wisdom that you carry. And so there is a comment about what do you think about coronavirus and using traditional medicines? I know you've chatted before about sweat lodges, and so what are some of your thoughts about maybe sage in the shoes, or just in general traditional meds and COVID-19?
Every nation of people has their own knowledge base about the medicines that grow on their land. And so it's hard to say use this medicine or that medicine because medicines are different across the country. But the first town hall that you invited me to, I talked about cedar. And I know that cedar grows across the land, but it's a little bit harder to get the further north you go. And those communities, they have their relationship with balsam trees, and they use a lot of balsam or pine in the same way that we would use cedar. And so our traditional medicines are critically important in this time, as is all of our knowledge. And so those medicines, we can't afford to talk about our knowledge and our medicines in comparison to Western-based systems. We have to talk about our knowledge and our medicines from our belief in them, from our own worldview. And so using our medicines is critically important. And I remember stories of both in the lodge that I go to, and I heard stories from Peter O'Cheese, the lodge that I go to, the Grand Chief there is Badwewidam Benesi, and otherwise known as Eddie Benton Benet. And they talk about the importance of strawberries, for example. So we're coming into spring. And the other day, when we were out taking care of some things in our yard, my daughter said, "Oh, Mom, look, there's a wild strawberry there." That little wild strawberry is an indication of hope, because the strawberry is the first plant, the first food that comes up in the springtime. So it's said to be the chief of all foods. Now, there's a whole ceremonial process that happens to ensure that food comes up every year, and it has to do with fasting. And so our medicines are connected, are important to us to help us maintain our balance, to improve and maintain our immune systems. So we can think about our medicines in that way. And we have to use all of them. We have to take care of ourselves because our relationship with those medicines are so critically important for sustaining us now, as well as our ceremonies. Like I said, we would never say that we might say some things about Western culture, but 1 minute. Okay. So our elders use our knowledge to make decisions about how people come together. And we should not assume that they do not have enough wisdom to ensure safety and how they come together in COVID-19. And so because we don't understand the ceremonial practices or the use of medicines, or when there's a lack of knowledge and understanding, we should not assume we have the right to criticize or to try and control the way that Indigenous people practice their ceremonies and their medicines. That's what sustained our ancestors and got us to today in this time, and that's what will sustain us into our future. So our medicines and our ceremonies are critically important, and we have to trust that our knowledge keepers know how to ensure safety and conduct our practices in a safe way.
Thank you so much, Carol. And speaking of sustaining, let's keep sustaining the messages. So I want to give a quick thank you to all of the people that share this message live. Of course, you can check out Facebook at FNHMA, APTN News, Wolf 95.7 in Fredericton, Eagle Feather News in Saskatchewan, NCIFM Manitoba, CFWE in Alberta, CKLB in Yellowknife, CJWE in Alberta as well, Element in Toronto and Ottawa, Alberta Native News, Micmac Maliseet News, Co-op Radio, and the First Nations Drum carrying us live. NCIFM is also carrying us live, and we have rebroadcast on radio with BC, in Saskatchewan, CKLB in Yellowknife, Co-op Radio Vancouver, and the Wolf 95.7. Speaking of sustaining further, don't forget to tune in same time next week. We're going to welcome back Dr. Valerie Gideon, Senior Assistant Deputy Minister from Indigenous Services Canada, to give us an update. Hey, Andy, look in Alberta. I see you. Thanks for joining in. Thanks to IHT Today, Stella, Don, Chris, Brenda for speaking today, Carol, Claire. Check out the National Aboriginal Council of Midwives, our partners, Thunderbird Foundation, and First Peoples Wellness Circle. So until next week, be well, stay safe, and stay home. Hi.